This conference will now be recorded.
All right, so I'm just going to talk about the key highlights of the document, which you now have. So this is a draft. That's the first page of it is here. You all know that I had asked for photos, and some of you gave me photos, which is wonderful because that highlights the folks that we aim to serve. And it shows that this plan is not just a big clump of papers. It has a final goal of serving these folks. So as you know, this is our region. This is just kind of a reference map, but we've got our 7 counties here: Peoria, Tazewell, Woodford, Fulton, Knox, Stark, and Marshall. And these are examples of 2 of the maps that we have. So there's many more in the document, but I didn't want to show all of them here. That would take far too long. So the key 2 populations that we're looking at right now are seniors and people with disabilities. So we took census data from census tracts from the US Census, and we mapped it. So you can see all the darker areas have the higher concentration of both of these populations, and this is region-wide. We also did this for just the urban area, just to show, since there's a higher concentration of folks, where specifically within the Peoria metro area that is. And it varies based on what populations we're looking at. These are, like I said, seniors, people with disabilities. We also have other groups, and they have different types of concentrations. So we looked at all of these groups because these are deemed as folks who would have a higher dependence on public transportation, or would just need extra assistance. So these are people in 0 vehicle households, disability status, seniors, poverty status, youth, minorities, veterans, and just the population density to show where people are in the region. So these are socioeconomic and some geographic factors. And we took all of those and bundled them into new maps. So these are transit dependent maps. The one on the left here, it shows the concentration of people from a combination of all those groups that I just said, across the whole region. So the darker purple, you could see there's a higher concentration in kind of the bigger cities. So we have Galesburg, Peoria, Pekin, and Canton, but there are still concentrations in the rural areas around as well. So it's important to highlight both because this plan aims to highlight the whole region. And then we focused in on the Peoria metro area on the right here, just to see where exactly which census tracts might need more help than others. So just a couple more slides here. As I mentioned, if you were at the last meeting, I mentioned that this plan tackled several different goals, or I should say it named different goals. So these are the 4 big categories. I won't go in depth too much. I'm just going to mention them for now, unless you want me to later. But for now, just so I won't take up too much time, we received feedback from across the region in different ways, and we put all this feedback specifically into creating these goals. This is not something that just Tri-County staff decided on. It was exactly deliberately from all the feedback we got. So people said they wanted more education regarding public transportation. They wanted expansion of services that could include things like accessibility. So not necessarily only geographic areas. It could mean time, days of the week, things like that. Then we've got infrastructure and multimodal options. So just trying to give people more options that they can choose from, because sometimes people don't really have the right to choose if they don't have different means that they can. And so the last one we have is affordability. This one, of course, varies throughout the region, but we did get some comments saying relating to affordability, and that could also be things like accessibility, different ways of paying. So there's none of these goals are black and white, but we want to focus on a little bit of an echo here. And it's gone now. Okay, we just want to focus on what we can do. Okay, and our could actually, someone is echoing. We need to mute someone over there. Okay, so we've got, this is the timeline that we're working with. We just completed our draft document and we're starting our 30-day public comment period that starts today. We hope to approve this draft on December 6th. Then that is our regular HSTP meeting. Then we have our technical committee meeting and the commission. So these are two standing committees that Tri-County Regional Planning Commission has, and we do have to go through those. So long story short, we will have, hopefully, if we go by this timeline, we will complete it in February. And that is what it is looking like. And that's about it. This is just, I clipped one page from the document itself, but that's about it. I just wanted to give a very brief introduction of the key parts of the plan. But besides that, I'll open it up to comments. And let me stop sharing there. So if anybody has any questions or comments, the floor is yours.
Can we respond by email with comments or not?
Yes, you sure can. You can email me anytime this month and I'll be happy. And if you don't think of any today, you can always call me. Yeah, so this is just one of many options for you to use if you like.
This is Mary. I thought the document was complete. It had things in it I never expected, but I'm glad that they were in there. The only comment I would make is really a question. How do we now let people know about all of these transportation availabilities in their communities? The reason I'm asking that is oftentimes the first time a person needs to use some of the extra other than say the public transportation is after they have had been in the hospital or had surgery or something of that sort. Then how would they know what is available? Because it seems to me they're talking to doctors, and it would be efficient to have doctors have pamphlets showing the availability of all the possibilities of them having their some transportation. And a while ago, I thought another place we could have something like that. Oh, I know. Our state representatives on the state level or city council or wherever, they all generally have a pamphlet that say seniors or youth would reach if they needed something in certain areas. And I have used that. And when people have talked to me, I've given them that. So it would seem that if at the source we could give out this information, I know it means printing costs, but that would be my idea. But you're probably already doing that, but I wasn't aware of it. Yeah.
Thanks.
CityLink does put a lot of does make an effort to get their booklets of schedules out. But I agree with you, and a lot of providers assume that because they see a bus go by, that it's a functioning route, or like I remember one day when the street was torn up by the Department of Human Services, and people were missing their public aid appointments, which would put them in a grave situation. And they said, well, I can see the bus go by. I don't know why they're not here. And it was because of the road construction that the people had to walk from a temporary stop. And because I understood it as a bus rider, I went and talked to the different offices and said, these people can't get here in time. So it is very hard. And I have to say that learning a bus route took me 6 weeks when I first moved to Peoria. Now, yes, I have spatial cognitive deficits, but it takes a long time to figure out the stopping distance of a bus and any differences. And many times I have ridden with people who could not read, and they didn't know where they were going. And I've watched bus drivers be amazingly helpful, but it's not an easy task. And doctors believe that if the bus route is accessible, or CityLift brings some people, that everybody can use it. And you can't turn a 40-foot bus around in the Glen Park office suite area, and all of those lots are independently owned, and people do not want a through street to University and to the ICC campus. And that's why that is a landlocked problem. It is a 4-block walk from Glen and Glen Park Place, and it is not divided by street corners, so you have to know your addresses. And if a person is ill, getting off the bus and walking back, and they stop at another doctor's office, that doctor's office will use their emergency process for someone coming in and call public assistance, like paramedics, and the person may miss their doctor's appointment altogether. So those are some very real, very good examples, Mary, of why it's important to keep things at doctors' offices. And I know that I would see staff from CityLink at 5111 Glen Park Place, and they weren't even asking that staff about the buses. They were just complaining that the buses and CityLift were always late. And because they're not bus riders, I really think we ought to ask them to ride the bus as part of their training and initiation so they can effectively help people. Thank you, everyone, for listening.
Thank you, Chris and Mary. Those are good points. Yeah, Mary, I don't think that we as Tri-County, we do not hand out pamphlets, but that's a really good idea. I know that some different organizations, I only know about the Peoria area, but if anyone from a different part of the region is here, you can correct me. I want to say United Way, they might have some information, but it's always worth checking if it's enough. Does it help people? What do we still need?
Thank you for the discussion.
Thanks, Mary.
Yes, Mary.
Anyone else have any sort of comments? It could be about the content or just the structure of the plan itself. Do you think we left anything out? I know it does look a little different from the last year's, if you were around, or not last year, but the 2016 plan.
Oh, Rima, the other thing that comes to mind now that we've had the discussion, how well do we inform our local representatives on the city council or the state senator or state representative about, say, something like this? And, you know, tell them we're available if they ever have any questions or if they need to send somebody to us. Do we let them know personally to their offices what, not only what we're doing, but say a document like this? I think that would be very interesting because maybe they initially wouldn't be able to read all of it, but they have staff, and their staff sometimes is divided among different types of issues. So they become well versed on an issue. So I think that would be very important if we can consider that.
Yeah, we do not personally reach out to them. We do, on Tri-County's email list, we have some state representatives, but definitely not all. Same with the local aspect, but that's a good point as well.
I find these meetings incredibly helpful. And when I have attended public meetings in person, I've seen some very effective listening because people usually attend them with a lot of painful experience, unfortunately. And I know that that can be hard. So I appreciate the courage to offer public meetings because people are not aware of how to approach an organization as big as CityLift with a problem. And so they tire quickly about not getting immediate response. Or if they get it, they don't know what it means, sometimes what people are talking about. So thank you, Rima, very much.
Thanks, Chris. Appreciate it. Yeah, like I said, we're trying to offer as many options as we can.
Rima. Hi, Rima. My name is
Wow.
Kylie. I'm from Express Employment Professionals. I've attended quite a few meetings in regards to transportation for our very qualified associates and getting them to and from locations as far as extending bus routes or even extending some bus times. It's just unfortunate that a lot of our clients, because we service a 30-mile radius of our office in Peoria Heights, which is including but not limited to Mapleton, Pekin, Morton, Washington, Chillicothe, even Metamora. Um, uh, Realistically, I understand that a lot of those places, people are going to have their own transportation, unfortunately. And according to the report that I read with your email, the number of households that don't have vehicles is astounding, and especially in certain areas of our community. I'm wondering, is there progress on maybe extending some of those routes and bus times, or maybe even alternative solutions to getting some associates? I've tried various things. In fact, got with the owner of one of our local cab companies to see if we couldn't do some discounted rates for our associates, things like that. That turns into a whole nother slew of problems in regards if people quit, then they don't pay us for what they owe for the cab fare. But I've been just brainstorming other alternatives, or is there progress in the routes? Just kind of an update on that, if you could.
Sure. Yeah, thanks for coming. I recognize your name. I know you're on my email list. So I know that the most directly relevant response I can give is for Washington, and he's not here today, but Jim Bremner, he's the township supervisor for Washington, and he worked so hard to be able to, with the Greater Peoria Mass Transit District, to be able to bring just a pilot project of service, specifically services for people with disabilities, to the Washington area. Now we applied on his behalf for a grant, and that's how they're getting the money for that. That's only 6 months for now. We really hope that we can extend it. That is the most directly relevant expansion that I know of. But I will say, before that pilot even started, Jim also talked with a local cab company. I think it's the Morton Washington Taxi Cab. And he, so actually, how they made that work was the township subsidized parts of the fares for seniors in that area. It's that zip code around Washington. So they managed that for a while. They were free rides. Recently, just like everything else these days, the fares went up a little, so they're heavily discounted now. So that's an example of some things that have worked. I know that yeah, that is temporary, but sometimes these temporary things can help latch on to broader things. So that's all that I'm aware of. Is anyone? Oh, Shamra's on the line. She could talk some
Yeah,
more.
I was just gonna just step into, we've been working with REMA on this pilot project, and actually we're gonna try to look at the data a little bit more and just see if we can expand the opportunity to keep it going a little bit longer. So we'll probably start getting together, I would say sometime this month, because the pilot would actually be ending close to the end of January. So we want to try to continue that service because we are collaborating also with Washington Community High School, and there's a need there to help some students that have mobility and disability challenges. So we want to try to service those needs. However, it's still kind of under that umbrella that it's with the pilot, but since they need some service too, hopefully that will help so that we can continue the service a little bit longer, because the kids, they wouldn't be getting out of school anyway until like May.
Yeah, I think the key here, at least theoretically, is to collaborate as much as possible. It's easy to say that, and we are in a public meeting, but I recognize that it's challenging to understand where to go and where to start. And that's just for us. But like Mary said too, where if a passenger or soon to be passenger also needs help, it's hard to know where to start. So the education component and kind of networking is necessary, but there's always ideas that we need of where do we go. If there's someone not on my list, maybe it's because I don't know about them. So that's why we work as a group.
When we had the disability forum over at the Civic Center, I think that was a really good demonstration of how people can get practice in education, because there was a fixed route bus there, and there was also a city lift vehicle. If we could do something like that for Bus Drivers Day, I think that's in November. I could be wrong, but that would be something where we could invite more people to the public to come. I know it was focused on disabilities, but people do. I noticed when I was working that attorneys would often ride downtown on the bus, and so because the discussions were just amazing while people were riding. But directions sometimes that the driver can't stop to do were needed, and people would help each other. I mean, if you get off the bus at that place, of course the driver is helpful. I've seen that happen 100%. But if where you needed to go in an office building was a concern, the driver might not be able to help with that. So someone else on the bus might be able to do so. And, so if we could think about that as another option, certainly to honor bus drivers because, they're required to be nice and on time at the same time, and sometimes that is difficult. But learning bus routes is a challenge, especially if you had a route that you drove that was different than the actual bus route, and that can be really hard to manage.
Right. Yeah, different folks have different learning curves, and everyone's coming from their own set of experiences as well. So it definitely makes a difference to have multiple options. Any other comments? Again, we do not have to keep this open for the whole hour, but wanted to give people a platform if they have any questions.
Actually, I do have one more question. I'm sorry, Rima. Is there a committee or somebody that determines the bus routes? How do we determine what areas are in more need of stops and maybe even further routes and even extended times, more times availabilities for these bus stops? Um, Again, back to my earlier problem is getting these associates to our client locations. Um, if they live in Peoria and the job is in Pekin, but it's in a part of Pekin that is miles away from the only one stop in Pekin. I just don't understand certain things and how we can go about maybe expanding. If you're already in Pekin, why don't you add 3 more stops? If you're coming over the Pekin Bridge, how much more is it to go 2 miles up the road to the Cat Mapleton plant where we have numerous people? I understand it's limited with one boundary, even though there's lots of people that work there that could utilize the bus services. I totally am understanding of the fact that it's not feasible for a lot of places, but what can we do to maybe get these expanded or have people that ride on the bus and say, you know what, we could have used another stop over there. How does that get determined is basically what I'm asking.
Yeah, that is a timely question. And I see Shamra's about to talk. I was right about to say, go ahead, Shamra, because you'll be best to answer this question.
Yes, if I could get your contact information, that would be great. But just to, I guess, be brief, we just did a comprehensive operational analysis, which is a COA, and we had some consultants. It was Nelson Nygaard that came down, and they actually went on all of our routes, and we made a big change. It's probably the first change that they've had in about 20 years that was major, and we knew that that was going to make a large impact on our riders. So we tried to make sure that we educated as much as we could so that people would know the new changes that were going to be coming about. So that was in March. And then going to Mapleton, it's just that we have to have different service agreements for different areas that we go to. So that's one thing. And of course, with everything, as you know, money is always a factor. And then we do have a shortage of operators as well. So those are all like a combination of things that kind of are the reasons why we can't go certain places. So, but we can have a further discussion. Just please give my contact information. I would love to talk with you.
Thank you.
Thank you.
Yeah, and actually I have both your contact information, so I can just send an email right after this and connect you guys.
Perfect. Thank you so much.
Thank you very much.
I will say, I was going to mention one thing that we added to this document. It's a little bit different than expected. Is that some of the staff in our office and I attempted to compile the public non-public transit transportation options around the whole region. This is not comprehensive because there's no way to really know all of that, but things like taxis, things like churches. Um, so we made a kind of a short, relatively short for the region, short list at the end of the document. It shows what we found. Um, Maybe these might help some folks. Not everybody goes to a church. Not everybody might be connected to those, but maybe they know someone who is in need that those might help. We do have some taxis on the list and some other type of uh, transportation options. So yeah, like you said, Kylie, there's maybe connection with some for-profit options, but there's a lot of exploration that has to be done.
Is there any way this very wonderful, articulate speaker can contract with the state of Illinois? I mean, the Department of Public Health has a taxi voucher system that they use with the taxis so that the person doesn't have to pay. But I can tell you, if you do not pay a taxi driver for the miles you have ridden and what's on the meter, they have the right to take you to jail.
Yes.
And some of the drivers are not shy. Just as if you are riding a city bus and someone is disruptive and the bus driver in his judgment feels for the safety of everyone, somebody needs to get off the bus, they can pull over. So, and wait for the police. So there are things about using taxis that do need to be educated. Also, Uber things need to be educated. But I would encourage you to see how voucher systems are created. For example, I, as a private citizen riding in a taxi, cannot create a voucher system and bill to a tab. They don't do that, but they might for an organization. And taxis their fares are set by the city, and so people can feel that it's unfair, and you do have to watch the meter because some drivers will drive with the meter on.
Okay,
I'm sorry, I couldn't understand.
I can actually address that. I was a cab driver on and off for 13 years here in the city of Peoria as well, which is why I'm concerned about areas for bus stops. Um, Generally speaking, if you have a specific amount of money, as far as cab drivers, and you let them know I only have this much, they're usually really good about working with you. But you are correct in the term that if you do not have enough money for the fare, they do have the right for theft of services. Um, Organizations such as the cab company that I worked for a brief time did have contracts with hospitals where they would give vouchers. So some cab companies do have that and some don't. You just have to inquire as to if you're at the hospital and you need to get a ride home and City Lift, it's past their hours or whatever it may be. There are those out there. You just have to inquire. But as far as rates being raised by the city or set by the city, that is accurate to a point. It just depends on if they're going to be classified as a cab or a livery service. A livery service can adjust and make their own rates, dependent upon the driver who is responsible for paying the gas, which, as everybody around knows, what the gas rates are right now, or gas prices are right now. So the cab company itself is intricate. You just have to do research and ask the proper questions and see if possibly some of these organizations will offer those vouchers.
Thank you for your help.
You're welcome.
Yeah, that's very helpful. I actually didn't know any of that, so this has been a learning experience for me too.
Well, that's one of the benefits of this meeting. I think I never leave without having learned something new, Rima, and it's not easy work. So thank you. And thank you for all the research your staff did.
Thanks, yeah. Okay, any other comments or questions? Give it just a few seconds or so. We can keep going till the end of the hour, but we don't have to, depending on what folks want. All right, one last chance, otherwise I will look to close the meeting. All right, okay, so let me get a motion and a second, please, to close the public meeting for the HSTP document.
So move.
Got
Second.
Chris and Craig. All right, we've got the meeting closed. That's actually an agenda item, but we have to call it a public meeting. So our next agenda item is other. I don't have anything else. Does anyone have anything else to bring up? All right, and moving on. Our last item is to adjourn. So we're going to adjourn at 12:43 p.m. Thanks again for joining us in this special meeting. Bye.
Thank you.
All right, Rima. And you're going to connect me with,
Yes,
okay, thank you.
I will do that now before I forget. I made a little note.
Thank you.
Yeah, I'm usually there in person, but I've got a cold today, so someday we'll meet in person.
Thank you.
I hope you feel
Thanks.
better. It's rare for you to be ill. So.
Yeah. I'll just get it out of my system, I hope. Thanks.
Who was the taxi, the retired